Ever found yourself with a sudden nosebleed and wondered what was going on? Don't worry, you're not alone. Nosebleeds, or epistaxis in medical terms, are actually pretty common, and they can happen to anyone at almost any time. A nosebleed happens when blood vessels in the nose rupture, causing blood to flow from one or both nostrils. The inside of your nose is lined with tiny blood vessels that are really close to the surface, making them easy to break and bleed. When these vessels are damaged or ruptured, you end up with a nosebleed. This nosebleed can range from a little trickle to a heavier flow, which might seem scary, but the good news here is that most nosebleeds are completely harmless. You might be surprised to learn that nosebleeds are really common, like really common. It's estimated that about 60% of people will experience at least one nosebleed in their lifetime. And out of those, around 6% might require medical attention. They are particularly common in children between the ages of 2 to 10 and older adults over 60. Types of nosebleeds. There are two primary types of nosebleeds. Number 1. Anterior nosebleeds. These are the most common type. They happen in the front part of your nose, where the delicate blood vessels are more exposed. Anterior nosebleeds are usually easy to manage at home and are rarely serious. They're often caused by things like dry air, nose picking, or minor trauma. Number 2. Posterior nosebleeds. These are less common but more serious. Posterior nosebleeds originate deeper in the nose, and the bleeding tends to be heavier. They're more likely to happen in older adults, especially those with high blood pressure or certain medical conditions. Posterior nosebleeds usually require medical attention to stop the bleeding. Causes of nosebleeds. So what makes your nose bleed? There are quite a few different causes. One of the most common causes is dry air. When the air is dry, especially during winter months or in arid climates, the nasal passages can become dehydrated and cracked, making the blood vessels more likely to rupture. Trauma to the nose is another frequent cause. This can include direct injuries, such as a blow to the face, or more subtle forms of trauma, like excessive nose picking or aggressive nose blowing. Even the repeated insertion of objects into the nose, such as nasal sprays or supplemental oxygen tubes, can irritate the nasal lining and lead to bleeding. Certain medications can also increase the likelihood of nosebleeds. Blood thinners, such as aspirin, warfarin, or heparin, make it harder for blood to clot and can lead to more frequent or prolonged nosebleeds. Some over-the-counter pain relievers and decongestant nasal sprays can also contribute to nosebleeds if used excessively. Medical conditions can play a role in causing nosebleeds as well. High blood pressure, for instance, can increase the pressure in the blood vessels of the nose, making them more prone to rupture. Blood disorders that affect clotting, such as hemophilia or von Willebrand disease, can lead to more frequent and severe nosebleeds. Allergies and infections of the nose and sinuses can also cause inflammation of the nasal passages, making the blood vessels more fragile and susceptible to bleeding. Chronic sinusitis, in particular, can lead to recurring nosebleeds. In some cases, structural abnormalities in the nose can contribute to nosebleeds. A deviated septum, for example, can cause airflow issues that dry out one side of the nose more than the other, increasing the risk of bleeding. Less commonly, nosebleeds can be a symptom of more serious conditions, such as nasal or sinus tumors, or blood vessel abnormalities. While rare, these possibilities show the importance of seeking medical attention for frequent or severe nosebleeds. Symptoms of nosebleeds. The primary symptom of a nosebleed is, of course, blood coming from one or both nostrils. However, the experience can vary depending on the type and severity of the nosebleed. In an anterior nosebleed, blood typically flows from only one nostril when the person is sitting or standing up. If the person lies down, the blood may flow back into the throat. The bleeding is usually fairly light and may stop on its own within a few minutes. Posterior nosebleeds often feel different. The blood may flow down the back of the throat, causing a person to spit or cough up blood. These nosebleeds can be more profuse and may be accompanied by a feeling of blood trickling down the throat. Regardless of the type, many people describe a sensation of warmth or wetness inside the nose just before the bleeding starts. Some may also experience a metallic taste in their mouth as blood drains down the back of the throat. The emotional experience of a nosebleed can be unsettling, especially for those who aren't used to them. The sight of blood can cause anxiety, and frequent nosebleeds may lead to worry about underlying health issues. Diagnosis of nosebleeds. For most people, a nosebleed is something they manage at home without seeing a doctor. However, if you have frequent or severe nosebleeds, it's important to get checked out. A doctor will typically ask about your medical history, medications, and any recent injuries. They might perform a physical examination, where they look inside your nose using a special instrument called a nasal speculum. In some cases, they might need to do a blood test to check for underlying conditions, like a bleeding disorder or anemia, especially if nosebleeds are frequent or heavy. How to stop a nosebleed. Most nosebleeds are easy to treat at home with basic first aid techniques. Here's what to do if you or someone else experiences a nosebleed. Number 1. Stay calm and sit up. The first step is to remain calm. Nosebleeds are often more frightening than they are serious. Sit up straight and tilt your head slightly forward. This helps to prevent blood from flowing down the back of your throat, which can cause choking or nausea. Number 2. Pinch your nostrils. Using your thumb and index finger, pinch the soft part of your nose just below the bridge. Keep your nostrils closed for 10 to 15 minutes without letting go. This helps to put pressure on the bleeding vessels and encourages the blood to clot. Number 3. Breathe through your mouth. While pinching your nose, breathe through your mouth. Avoid blowing your nose, as this can dislodge any clots that have formed and cause the bleeding to start again. Number 4. Apply a cold compress. A cold compress, or ice pack, placed on the bridge of the nose can help constrict the blood vessels and slow the bleeding. You can also apply a cold compress to the back of your neck to reduce blood flow to the nasal area. Number 5. Avoid lying down. Lying down can cause blood to flow down the throat, increasing the risk of choking or nausea. Stay upright until the bleeding stops. Number 6. Repeat if necessary. If the bleeding hasn't stopped after 10 to 15 minutes, try pinching your nose again for another 10 minutes. If the bleeding persists after multiple attempts, seek medical attention. Treatment for nosebleeds. If the bleeding doesn't stop after about 20 minutes, or if it's a posterior nosebleed, you should seek medical help. In medical settings, treatments might include: Number 1. Nasal packing. This involves placing special gauze or a nasal sponge inside the nose to apply pressure and stop the bleeding. Number 2. Cauterization. In some cases, a doctor might use a chemical or electric device to cauterize or seal the bleeding vessel. Number 3. Medications. If nosebleeds are due to an underlying condition like high blood pressure, treating that condition can help prevent future nosebleeds. Frequently asked questions about nosebleeds. Number 1. When should I be worried about a nosebleed? You should be concerned if the nosebleed lasts longer than 20 minutes, if it's happening frequently without a clear cause, or if you're feeling lightheaded or dizzy. In these cases, it's best to seek medical attention. Number 2. How can I prevent nosebleeds during winter? During winter, the air tends to be drier, which can lead to more frequent nosebleeds. To prevent them, use a humidifier in your home to keep the air moist, and apply a saline nasal spray regularly to keep your nasal passages hydrated. Applying a thin layer of petroleum jelly inside the nose using a cotton swab can also help keep the nasal passages moist. Number 3. Does drinking water help prevent nosebleeds? Yes, staying hydrated can help keep your mucous membranes moist, which can reduce the likelihood of nosebleeds. Now, we want to hear from you. Have you ever experienced a nosebleed that caught you off guard? What did you do to stop it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.